Essentially, what we're trying to achieve is understanding the patient's subjective pain experience. From the time that Professor McCaffrey introduced the concept that pain is what the patient says it is, existing whenever he or she says it does. It is accessing that experience. So nurses and healthcare professionals need to believe the patient, they need to listen to the patient, so communication skills training is extremely important. Using validated, straightforward tools is an aspect of undergraduate education that needs to be very much improved. These tools are very straightforward, but they allow us to document the patient's experience, to record it, then give interventions, and then recheck with remeasuring how effective those interventions are. So using a straightforward validated tool, such as a numbers rating scale, with 0 being no pain and 10 being the worst pain possible, and the patient can put a number on that pain, their pain experience, which can then be followed through and checked back. Now, patients don't like to feel that they're being not heard from their own emotional experience. So they like to give verbal descriptors to their pain experience. And we have verbal scales that can be used alongside numerical rating scales so that the patient can describe their pain. If they have no pain, if they have mild pain, if it's moderate, or if it's severe, excruciating and horrendous. And they can really give a subjective account of how that feels. So that needs to be documented. Interventions need to be appropriate and effective, and that is why the measurement is so important, because if we don't know the level of the patient's experience, interventions may not be sufficient. And pain is therefore undertreated, and whether pharmacologically or non-pharmacologically, and preferably the combination of the two, the intervention isn't effective and doesn't impact on the patient's pain experience. What we're trying to do is restore the patient to full health, to maximum quality of life, but primarily treat the pain so that the pain is removed.